Optimal performance training is the most individualized training model to implement to an athlete because it can easily be used to track their growth and development. The OPT model is a process of systematically progressing an athlete towards a performance goal. Within the OPT model, there's a progression of 3 phases: stabilization, strength, and power. This progression is a form of integrated training, which is a comprehensive approach to training that attempts to improve all components necessary for an athlete to perform at their highest level, while also preventing injury. As a part of an integrated sports performance program, there are several key training components to optimize performance. These training components are core, flexibility, balance, cardiorespiratory, speed, agility, quickness, resistance, and plyometric training. In each component, the 3 phases of the OPT model are used as a progression for performance. All of these components need to be tailored to the athlete and the demands of their sport, while also developing growth of the entire human movement system through the use of correct functional movement patterns and posture. Admittedly, the OPT model is lengthy and difficult to address all of the components each week, while still allowing the athlete to get optimal rest. But this program, when applied appropriately, allows for the components of training to be intertwined and uses some components as a foundation and moves away from them as the demands of training and athletic performance increase. A study by Chimera found that core strength assessments as well as lower extremity range of motion assessments were predictive in determining scores on the functional movement screening. These assessments directly relate to why the OPT model should be used as a training program, since it's able to develop flexibility as well as core stability, strength, and power. Another study by Slowalski found that the use of a 6-week progressive resistance training program performed twice per week was able to decrease muscular imbalances in the quadriceps group in male junior elite soccer players. This program was implemented alongside their normal on-field training regimen, which shows that the OPT model can be woven into the general training of an athlete. Geriatric patients can also benefit from the OPT model through the use of resistance and balance training, which have been shown to increase leg power, trunk strength, and balance. It is commonly believed that the strength program alone, with an upper body and lower body push and pull motion, will suffice and benefit an athlete. But, as you can see, a multifaceted and integrated approach is much more feasible and can be applied to all athletes and skill levels to enhance their performance. An example of this is a study by Dahlin, where ice hockey players were assigned to either a strength group or a strength and plyometric group. As a result of training 5 days a week for 8 weeks, the group with plyometrics added into their program had significantly increased their on-ice 10-meter sprint performance. The optimum performance training model can be implemented to athletes of all ages, extending from youth to geriatric populations. The exercises being used simply have to be specific to the goals of the individual as we progress forward through the phases and different components of the OPT model. In the end, we can use the different components and phases as a form of tracking progress for the athlete as we see their performance increase.